Hello, everyone. I'm Vin Ebenu here at the Point Pleasant Boro EMS Squad with Captain Andy Welsh to discuss ways EMS riders and workers are responding to the COVID-19 pandemic, what precautionary measures they're using to keep clean and healthy, and what they're doing inside the first aid squad with the rigs and the building itself to make sure that everything is healthy as well. Captain, these are unprecedented times, certainly no playbook going into it. Certainly a lot of training has prepared you for a lot of different situations, but what precautionary measures, is there anything that you would normally do that you're able to do now, or has it just been exemplified?
So what we're doing now with all our calls is we're taking extraordinary precautions for every patient we deal with. Obviously, with the ongoing COVID-19 crisis, there's a lot of things that come into play, and the protection of our members and every patient and every member of town we come into contact with, we want to take the utmost safety precautions for everyone involved. One of the first things we've done is on every call we go on now, our membership is in Tyvek suits. So if anyone does call the ambulance or sees us out, they're going to see them in a white Tyvek suit. You're also going to see them in a respirator, a P100 respirator, either face shield or goggles, and boot covers. You're also going to realize that when we go into houses, extra precautions are going to be taken. It's going to take us a little while to get inside. Obviously, before this crisis took place, we were going into houses, a little quicker, getting the care we could right away. Now we have to take the precautions to protect our membership, protect the agency, as well as protect the patient from any other infection that could possibly happen. So we're still able to provide the same level of care we've always had in Point Pleasant Boro, and now it just takes us a little while longer to get inside the houses to make sure everybody's safe, both the patient and the crews involved.
Now, take me through a typical day, or a normal day, if we can call it that right now, of responding to any call, whether it's somebody has reported symptoms that you have to end up picking up, or if it's another medical related episode. Take me through again what steps you and the rest of the first aid squad have to do to make sure that you're protecting yourselves before you hop in the truck or the rig and then head to a call, and then what you have to do when you return back.
So what's going to take place in any call until, unfortunately, this pandemic ends is our crews are going to get suited up either at the scene or at the building. Like I said, they're going to put on a Tyvek suit. They're going to put on feet covers. They're going to get the feet covers are going to be secured via duct tape. They're going to have gloves over top the Tyvek suit, which are going to get secured via duct tape. They're going to put on a respirator. They're going to put on a face shield. We've had to seal the back of the ambulances off with plastic. This is to ensure that no infection can get out of the back of the truck, which is vented and sealed for a reason. And then the membership from there, we bring limited supplies into the residence. That's something new we've had to do. We've gone to automatic blood pressure cuffs and different electronic things to help assess patients. We're not bringing in our full duty bag unless we absolutely have to, just to prevent that from being covered in any type of possible infection if there was to be one in the house. When the crews are done, we've taken to a whole new level of decontamination. The first thing that happens as soon as the crew discharges the patient at the hospital, the entire back of the truck, front and back, is wiped down with bleach wipes. While the members are doing this, they're still in personal protective equipment, Tyvek suits, face shields, things of that nature, just to ensure that none of the members, can get infected or get any of that, bleach or anything on them. Once we get back to the building, we've set up a decontamination tent in our station. The members will go in, they'll decontaminate, they'll take their gowns, their PPE off, go to the clean zone of the tent, get into their regular clothes, and then immediately go home or go into our station to shower. And then there's a boatload of new decontamination that takes place at the first aid station. From there, what takes place is we now have a spray blower that was donated by one of the residents in town. We take that spray blower that blows a disinfectant all over our decon tent, front and back, so the entire tank is deconned. Then we remove everything out of the truck, stretcher, anything that's easily removable. That crew then goes in, decontaminates the whole ambulance with, again, this spray decontamination agent. And then that sits for 10 minutes, and then the truck then gets wiped down one more time to ensure that it's totally disinfected and ready for the next patient.
Now, so before we got on camera, kind of how that works with decontaminating the rig with what almost looks like a leaf blower and something you could pour gasoline into, I guess, if you were using it for a typical leaf blower. But take me through again how, what kind of disinfectant goes into that, and, what exactly has to be done Where does it have to be sprayed? Is it something that's you could just kind of hose all around the truck, or do you have to hit every single spot in the truck to make sure that everything is clean?
So it is. It's a typical leaf blower. It has a tank on top for the solution. The cleaning solution is bought by a company up north. It's brought down here. It's already pre-mixed, so it's nothing that we mix by ourselves. It's already an industrial strength decontamination agent. And then when the crews go in to decon everything, it's spray as you go. Obviously, they go in to try to get all the nooks and crannies that they can, but they can just kind of spin it around. It is aerosolized, so it floats around the truck, goes into all the cracks and crevices. But our crews make sure they go over it once or twice and we know the areas of our truck that are hard to get. We make sure we goes over those areas several times to make sure that we get everything cleaned.
Now, how often do you have to clean each of the trucks and the first aid squad building itself? Is it after each and every single call? Is it just once a day? How often and when do you make sure that you go about these cleaning methods?
So since the COVID-19 pandemic has started, every single call the truck goes out on, the cleaning precautions that you guys will see on the video that we took earlier could take place. Every single truck, every single time the truck goes out, we ensure that everything is properly deconned 100%. The building gets professionally done once a week by a company. They do our crew quarters, our kitchen, things like that. Then the crews on duty once a day disinfect the building as they go around their business. And then, like I said, the trucks in the truck bay where our medical supplies are, that's disinfected after every single call.
What are some of the things have you had any discussions with other EMS or first aid squads in the area about maybe what they're doing, and then maybe sharing what you're doing in terms of precautionary steps taken to keep yourself, the individual, clean, as well as the trucks, the first aid squad building, making sure that everybody involved with the call, whether it's the person you're responding to and everybody on the truck, is safe in the best way possible and taking every precautionary measure necessary to stay healthy?
So on every call, we have an officer in charge, whether it's a lieutenant, a sergeant, or just a senior member. It's that person's responsibility to make sure that the crew that's going in the house has everything done, that they're properly suited up. There's a safety check outside. This is to all make sure that none of the steps are missed. Obviously, prior to this happening, you didn't really see a lot of EMTs and paramedics going into a house in full Tyvek suits and things like that. Now, unfortunately, this has become the new normal. So we have safety steps in place to make sure that every crew member that goes in a house, that disinfects the truck, that takes care of a patient, all those things are checked off. In regards to talking with other agencies, we've been very vocal with other agencies. We work very well with Point Pleasant Beach, Brick Township, other agencies in the county, to make sure that we're all kind of doing the same thing. And right now, all three agencies that we work closest with are doing the same type of decontamination procedure. So it seems to be almost countywide. Either they have their own equipment to do it, or the county has been nice enough to set up places where squads that don't have this type of equipment or weren't able to afford this type of equipment are able to take their truck so they can get clean the same way ours are.
What are some of the other risks and challenges? Certainly any type of first responder, nurses, doctors, EMTs, EMS riders, police officers, any kind of medical professional, law enforcement officer is at some risk responding to any and every such call nowadays. So what has this time been like for you and the rest of your squad?
It's stressful. It's stressful for the members. I know everybody in the public is nervous or scared. There's a lot of people that have a lot of anxiety over this, and I can tell you that it's shared amongst the members here and probably the entire first responder and public safety community, whether working in a hospital, doctor's office, healthcare, police officer, firefighter, or the EMTs and paramedics on the road. It's a very stressful time, and we're doing the best we can to keep ourselves safe. And I know that every day our members get on the truck, and I'm sure they have a pit in their stomach because they're nervous, because I'm nervous. But we're going to still go out there and we're going to do what we have to do because that's our job and that's what we signed up to do.
Captain, I want to close up with this. I guess some positive or a lighter note. Certainly there's a lot of very grateful people here in Ocean County, across the Jersey Shore and beyond, for the work that first responders are doing and the risk that they're taking to make sure that everybody's staying safe and healthy. What has that meant to you and your squad to receive such support from the community for everything you're doing?
The outpouring support in Point Pleasant, Boro is amazing. I can say that I was born and raised here, and every day this town makes me prouder, and I know the members that are here today that are working through this couldn't be happier. Between the donations of food, personal protective equipment that we've run out of, and the town people have stepped up to do it, our mayor and council supporting us every way they can. I can honestly say that everybody in this agency is grateful, and even just the honking of the horn that you saw go by really means a lot to a lot of people, because it is a very nerve-wracking time for everybody. And like I said, the members are nervous, but they're, as they say, they're saddling up and doing it anyway, and that's important. And that re-encouragement really is a big thing.
Captain, thanks for taking out some time today, and more importantly, thank you and your squad for everything you're doing every day to make sure that everybody's safe and healthy and protected as we continue to search and battle through this pandemic together.
Thank you very much. I appreciate it.
That's Captain Andy Welsh with the Point Pleasant Boro EMS Squad. I'm Vin Ebenau. Stay safe, stay informed, and stay home.